Look at the side of your neck right now. Run your fingers down from the back of your ear to the top of your collarbone. Are there any small, soft little flaps of skin, the kind that catch on your necklace? The kind your dermatologist looks at and says, completely benign. You can have them removed cosmetically if they bother you. If you have one, look closer. You probably have 8, or 12, or 23. Those skin tags are not age. They are not just genetics. They are the most reliable, visible from across the room sign of a hidden diabetes warning your doctor is not running the test for. Not your blood sugar, your insulin. Two completely different numbers. One you have been measured on for years. The other, almost no primary care office is ordering. Subscribe to Dr. Pendergast, leave a like, and drop your age and the number of tags you can count on yourself in 2 minutes in the comments. We are working toward 10,000 subscribers, and we are building this channel on one principle. The medical system makes money when you stay sick, not when you get better. I'm Dr. Edward Pendergast. I'm an endocrinologist. I have spent my career managing blood sugar in women whose primary doctor told them they were borderline pre-diabetic and handed them a pamphlet. Almost every one had a constellation of skin tags on the neck, the underarms, the breast fold, the eyelids. None had ever been told what the tags meant. Today, I am going to fix that. I am not selling anything. I do not have a course or a supplement to push at you. The only thing I want is for you to leave this video knowing what your body has been telling you for 10 years. Stay with me. I am going to show you what your skin tags actually are at the cellular level. The named insulin study every endocrinologist reads in residency. The one home test you can do tonight in 30 seconds. The single blood number to ask your doctor for. And the 3 small changes that stop new tags from forming. And at the end, I am going to point you to the second hidden warning these same insulin patterns are creating. The one that shows up at night in your kidneys. Before I show you what skin tags actually are, I have to clear away the 5 stories you have been told about them. Because if any of these stories is still parked in your mind, the rest of what I tell you will not land. Wrong story number 1. It is just genetics. My mother had them too. Yes, your mother had them. Your aunt had them. Your grandmother had them. That is not because skin tags are genetic. It is because insulin resistance is partly genetic. The tags are the surface readout of the metabolism running underneath. What runs in your family is the metabolism. The tags follow the metabolism. Saying skin tags are genetic is like saying floods are genetic because they keep happening on the same low-lying street. The street is the genetic part. The flood is the metabolism. Same family, same genes, same metabolism, same flood. Wrong story number 2. It is friction from clothing, from my collar, from my bra strap. Friction explains where they appear. It does not explain why. Walk through any nursing home and you will find women who wore the exact same blouses for 50 years. Some have 100 tags. Some have none. The friction was the same. The metabolism was different. Friction is the location. It is not the cause. Wrong story number 3. It is normal aging. The timeline argues against this. Skin tags appear most often in the 40s and 50s, when insulin resistance is brewing under the surface, but fasting glucose still looks normal on paper. They are not late-life changes. They are midlife changes. By the time you are 80, the metabolic damage is already done somewhere else in the body. The tags arrive during the warning window, the window your annual exam was supposed to catch. Wrong story number 4. It is HPV. This one is worth pausing on. There are skin growths that are HPV related, common warts on the hands and feet, plantar warts, some genital lesions. Those are real, they look different, and they need different treatment. The soft pedunculated tags on your neck and your underarms and your breast fold, appearing in your 40s and 50s on otherwise healthy skin in a non-immunocompromised adult, those are not HPV. The clinical literature names them acrochordons, and the strongest correlation in adults is metabolic, not viral. A real published study by Sari and colleagues in 2010 found that women with multiple acrochordons had significantly higher insulin levels and significantly higher HOMA-IR, the standard insulin resistance index, than matched controls without tags. The same finding has been replicated by Tamega, by Rossi, by Demir. It is not a fringe finding. It is the consensus. And here's what I think most doctors get wrong about this. Removes the tag. The dermatologist is correct that the tag itself is benign. It will not turn into cancer. But the dermatologist treats the tag the way a plumber treats a puddle on the kitchen floor. Mop up the puddle. The pipe is still leaking. 5 tags grow back. The dermatologist is not wrong. The dermatologist is just looking at a different layer of the problem. The plumbing is upstream. Wrong story number 5, the most dangerous one. I would know if I had diabetes. You almost certainly would not. Insulin resistance, the metabolic state that grows tags, predates diabetes by 5 to 10 years. Your fasting glucose stays in the normal range during that whole decade because your pancreas is working overtime to keep it there. Your insulin is climbing. Your A1C is creeping up to 5.7, then 5.8, then 6. The pancreas is screaming and nobody is listening because nobody is running the test that would hear it. Your annual physical measures glucose. It does not measure insulin. The tags are the only visible thing your body has going for it during that decade. And they are the most reliable thing your body produces. In my experience, and I have done this with hundreds of women in their 50s and 60s, when we run a fasting insulin alongside the fasting glucose, the glucose is fine, and the insulin is 2.5 times what it should be. The tags on the neck were the only public statement the body was allowed to make. So those are the 5 wrong stories. Genetics, friction, aging, HPV. I would know if I had diabetes. But here's what no one's told you yet. What those tags actually are at the cellular level, why they appear where they appear, and the name study that should be hanging in every primary care office. Point 1. What a skin tag actually is at the cellular level. A skin tag, scientifically named an acrochordon, is a small overgrowth of 2 kinds of skin cell. The first is the keratinocyte. That is the most common cell in your skin's outer layer. The second is the fibroblast. That is the cell that builds collagen and connective tissue underneath. Both cells in a tag have multiplied more than they were supposed to in a small focused area on a thin stalk of skin. The stalk is what makes a tag soft and pedunculated, what lets it dangle, what lets it catch on your necklace. What pushed those 2 cells to multiply? An overstimulation signal, a growth signal. And here is where insulin enters the story. Point 2, why insulin specifically? What insulin actually does to your skin. Most people think of insulin as the hormone that moves sugar out of the blood and into the cell. That is correct. That is its main job. But it has a second job that is almost never explained at your annual exam. Insulin is also a growth signal. It tells cells broadly, multiply, get bigger, build. Insulin tells cells to grow by binding to a second receptor, called the IGF-1 receptor. IGF-1 stands for insulin-like growth factor 1. The IGF-1 receptor sits on the surface of keratinocytes and fibroblasts. Insulin and IGF-1 look so similar at the molecular level that when insulin levels are very high, insulin starts binding to IGF-1 receptors in addition to its own receptors. And that is when skin cells get the multiply and build signal at a volume they were not designed to handle. A normal fasting insulin in a metabolically healthy adult is below 6. Some labs say below 5. In a woman with insulin resistance, fasting insulin can run 12, 15, 20. That is 2 to 4 times the normal signal pouring onto her skin cells every hour of every day for years. The tags on her neck are the cells that finally said yes. What surprised me in the literature when I first read it in residency was how strongly the count of tags correlated with the HOMA-IR score. Is the index your endocrinologist uses to measure how resistant your cells are to insulin. The SARI study, 2010, found that women with more than 5 acrochordons on their bodies had a HOMA-IR almost twice as high as women with none. Not a small difference, not a borderline finding, almost double. Let me tell you about a patient. I will call her Margaret. She was 67. She came to my office because her husband had just been diagnosed with type 2 diabetes, and her primary care doctor had told her she should get her own numbers checked, just to be safe. Her fasting glucose was 91. Her A1C was 5.8. By every standard primary care metric, she was fine. Borderline pre-diabetic. Pamphlet given. I asked her to pull her hair up so I could look at the back of her neck. There was a darker velvety band. I asked her to lift her arms so I could look at her axilla. There was a cluster of 14 skin tags. I had her. Count the tags on her body that night. The total was 41. I ran a fasting insulin the next morning. It came back at 22. The healthy upper limit for that lab was 10. Margaret had been told she was fine for almost a decade. The skin had been telling her the truth the whole time. The lab she needed had not been ordered. Point 3. Why these specific locations on your body? Why the neck? Why the underarm? Why the breast fold? Why the groin? Why the eyelid? 3 things have to be true for an insulin-driven tag to form. The skin has to be thin, the skin has to be warm, and the skin has to fold against itself or against clothing. Friction prone. Look at the locations. The side of the neck, thin skin, warm, folds when you turn your head. The underarm, thin, warm, folds against your arm constantly. The breast fold, thin, warm, folds against the chest wall. The groin, thin, warm, folds. The eyelid, thinnest skin on your body. Warm from blood supply, folds every time you blink. The 4 most common tag locations in adults match the rule perfectly. The friction does not cause the tag. The high insulin causes the tag. But in friction-prone, thin, warm skin, the IGF-1 signal gets amplified. So those are the places you see them. This is also why men who never wear a bra do not get tags in the breast fold the way women do. The skin location matters. The amplification matters. Insulin alone, in cool, thick skin like the front of your shin, will not typically produce tags. Point 4. Why women see this more than men in the 50 to 70 window. The estrogen story. Before menopause, estrogen levels are higher, and one of estrogen's many quiet jobs is to make insulin work better in your tissue. Premenopausal women are, on average, more insulin sensitive than men of the same age. The same metabolic load that grew tags on a man at 35 will not grow tags on a woman until estrogen falls. When estrogen falls in perimenopause and menopause, the insulin sensitivity that estrogen was paying for falls with it. The same diet, the same body, the same family suddenly produces tags. The tags did not come out of nowhere. They came out of the metabolism that estrogen had been masking for 30 years. This is why so many women look back and say, they all started in my 50s. They did. Not because the metabolism changed in your 50s, because the hormonal cover changed in your 50s. Point 5. Why your dermatologist is not telling you this, and what it means about how to get the right test. I do not want this to land as a complaint about dermatologists. They are good at what they do. They are trained to read the skin layer. They are trained to identify malignancy, infection, inflammatory disease. The skin tag, looked at as a skin object, is benign. They are correct that it is benign at the surface. But benign means this thing will not kill you. It does not mean this thing is meaningless. A messenger is not the message. A symptom is not the disease. I disagree with the standard primary care advice here, which is to wait until fasting glucose rises before doing anything. By then, the tags are not the only sign on the body. They are joined by darker skin behind the neck, deeper hair thinning, slower wound healing on the legs, and the early kidney changes that show up first as nighttime urination. Waiting for glucose to rise is waiting for a decade of damage. There is a second hidden driver of these tags I am not going to fully unpack in this video, and I want you to know now so you stay until the end. It is about why these same insulin patterns silently start damaging your kidneys years before any nephrologist tells you. I cover it in a separate video, and I will name the exact title at the end so you can watch it next. So that is the cellular and metabolic and hormonal explanation. Our skin cells multiplying because too much insulin is pouring onto them through the IGF-1 receptor. The locations match the rule of thin, warm, folded skin. Women see them more in their 50s because estrogen stopped covering the metabolism. And the dermatologist removes them because the dermatologist is reading the skin, not the metabolism underneath. So what do you do tonight? And what one number do you ask for at your next appointment? The tonight test. 30 seconds. That is all I'm asking. Stand in front of a mirror. Pull your hair up. Turn your head to one side. Count the soft little flaps of skin on the side of your neck. Then turn your head the other way and count those. Add the two numbers. Then write that number on a piece of paper with today's date next to it. That number is your 0 point. If you are over 50 and that one next side number alone is 6 or higher, your fasting insulin has almost certainly been running too high for at least 5 years. You do not need to count anywhere else tonight to know where you stand. The eyelids, the bra line crease, the underarm, those are the ones most women miss when they look. We will get to them in 90 days after the neck count starts dropping. The one number to ask for, fasting insulin, not just fasting glucose. Most labs run the glucose number as part of your annual blood work. Almost no primary care office orders the insulin without being asked. Below 6 is metabolically clean. 6 to 10 is the silent zone where your tags are forming right now. Above 10 is insulin resistance that needs work, regardless of what your A1C says. Walk into your next appointment with one written sentence. Please add fasting insulin to my next blood draw. That is the whole script. Do not explain, do not apologize. The lab will run it. It costs almost nothing, and it will tell you the truth your A1C cannot tell you yet. The 3 changes that stop new tags from forming. Walk 10 to 15 minutes within 30 minutes of every meal you eat. Not later, not before, after. Short post-meal walking is the strongest published behavior for clearing glucose without medication. The reason it works is mechanical. When your leg muscles contract, they pull glucose out of your bloodstream into the muscle cells through a transport called GLUT4, independently of insulin. The pancreas is allowed to relax for those minutes. Over weeks and months, fasting insulin falls. The IGF-1 signal on your skin falls with it. The next change: eat protein and fat before the carbohydrate at every meal. Eggs before toast, cheese before crackers, chicken before rice. The published work by Shukla and colleagues and by Iwasaki and colleagues shows that food order alone, not what you eat, not how much you eat, just the order, drops the post-meal glucose spike by 25 to 50%. Lower spikes, lower insulin, lower IGF-1 signal on your skin. And the last one, stop snacking. 3 meals, no grazing in between. Insulin needs hours to drop after a meal. 3 to 4 hours of nothing by mouth. If you snack every 2 hours, your insulin never falls. The tags cannot stop forming while insulin stays high. This is the hardest of the 3 for most women I work with. It is also the one with the largest effect on fasting insulin within the first 8 weeks. Your skin is not your enemy. It is a signal, and you now know what it is signaling. I'm Dr. Edward Pendergast. I have spent years watching women count more tags every year, then walk into my office a decade later with stage 3 kidney disease, vision changes, and a new diagnosis of full type 2 diabetes. The tags were the canary. Listen to them while listening still helps. Tonight before bed, count yours and take a photo. In 90 days of walking after meals and protein first eating, count again. The number stops going up. New tags stop forming. The disease underneath stops moving. Forward. If your sister, your mother, your daughter, your friend has these tags, send this video to them now. Most women have never been told to look. My own mother counted 23 tags on her neck the week she was diagnosed with stage 3 kidney disease at 74. I do not want that for the women you love. This is educational information only. Talk to your doctor before changing medications, especially if you are already on a glucose lowering or blood pressure medication. Walking after meals and changing food order are safe for almost everyone, but you know your body and your prescriptions. Run it past someone who has your full history. And here it is, the second hidden warning I told you about at the start. If you have skin tags, your kidneys are running on the same insulin fuel. The earliest sign in the kidney is showing up at night, not in the morning. Watch my next video. Why you're waking up to pee 3 times a night is not your bladder. It's your kidneys. Link in description and the card on screen now. If this helped you make sense of what your body has been trying to tell you, subscribe. I publish a new video every morning.